Two new studies show Omicron is less likely to result in severe symptoms and hospital admission than earlier COVID strains. Research from Imperial College London has indicated that people with Omicron are 20% less likely to need to go to hospital and 40% less likely to need to stay overnight. But the director of the study warns health services could still be overwhelmed.
But of course, with this very, very rapid rise and increase in cases, and we've seen the national cases go above 100,000, then of course, more cases means more pressure, because if even though a smaller proportion might get severe disease or go into hospital, that could still result in many cases. And of course, that could give pressure on the health service.
A separate study by scientists at the University of Edinburgh says the risk of hospitalisation is 2/3 less with Omicron than Delta. Health Secretary Sajid Javid welcomed the findings but said the government would be keeping an eye on the data.
We do know with Omicron that it does spread a lot more quickly, is a lot more infectious than Delta, so any advantage gained from a reduced risk of hospitalisation needs to be set against that.
On Wednesday, Britain reported more than 100,000 new daily cases for the first time since widespread testing was introduced. Vaccination centres saw long queues outside.
We've had a lot of people come forward for the first dose now, so I think some of those people that were relying on herd immunity or just hoping to wait it out have realised that COVID's not going anywhere anytime soon.
Data released by NHS England Thursday morning shows the number of staff absent because of COVID is rising. On the 19th of December, nearly 19,000 staff members were off work for COVID reasons, a 54% rise on the previous week. NHS leaders say their service is under significant pressure. David English, NTD News.